Good afternoon. Can somebody confirm if you can hear me? Otieno, can you hear me?
Yes, I can hear you.
Oh, okay. Thank you. Thank you for confirming. All right. Good afternoon, team. You're most welcome to our virtual training today. I can see the numbers are still quite low. We are about 66, and our expectation is to have close to 500 people or participants. So I'm requesting that we reach out to our other colleagues to join, and we can propose to start at 10 minutes past 2. Otieno, guide, is that good time to start? Or what would be your advice?
Yeah, that would be a great time to start. If we pass the 100 mark, I think we can just get started.
Okay. Thank you for the guidance. All right. So meanwhile, let's mobilize our colleagues to join. We can propose to start either at 10 past 2, or if the moment we cross the 100 mark, 100 packs mark, we can then begin. So thank you, and you're most welcome. We'll begin as soon as whichever comes first, either if we reach the 100 mark or at 10 past 2. Thank you. All right. So I think it's good time for us to begin. We are at 112, so we have a good number of participants already in the house, so we can begin our session. So once more, good afternoon all. My name is Franklin Songok. I work at NASCOP SI unit. I lead the HIS subunit under SI. So today we're going to be discussing one of the enhancements that has been done to KenyaEMR. Of course, currently we're talking about 3.x, that's the facility-wide EMR. And these trainings are organized through NASCOP, of course, with support from our HIS partners, Palladium taking lead through KenyaEMR3 project. And we are happy to welcome all of you. Feel appreciated. We really thank you so much for the support that you've given us so far and the work you're doing, especially in ensuring that sites are upgraded and we migrate to 3.x. So I know previously we've tried as much as we can to ensure that we handle all the features that have been enhanced. We began by looking at the new tools. Kindly note that the new tools is available in 3.x, so you may not really enjoy the luxury of accessing the new tools if you're still using an older version. So the revised HIV-MRE tools are available in 3.x, and we began by just building your capacity to be able to upgrade your sites so that you can access the new tools. Then we took you through the order creation and, of course, the community dispensing. That's the community pharmacy module. We also took you through Ushauri and Nishauri, and we also focused on the Dawa drop. So today we'll be discussing on issues around how do we do the billing, how do we ensure that we take care of the billable services within KenyaEMR3.x. We'll also be able to go through appointment management and also understand how best can we ensure that we how do we handle service queues, or how do we ensure that our clients are attended to based on how they present themselves to the facility. So I think, Otieno, you'll correct me here if I'm wrong. We are remaining with one session to be able to take care of all the features. We're remaining with one session. That's the stock management bit. And I think we should be able to dispense with that next week or the week after next week. But towards the end of this, we will provide further guidance on the same. So having provided that preamble, I don't know, Otieno, I want to request someone to pray for us. I know most of the participants don't have the mic. Can I request Magdalene? Now that you have the mic, Magdalene, I know you'll be part of the team presenting, but you can just lead us in a word of prayer. Magdalene, if you don't mind.
Okay, let's pray. Thank you, Father Lord, for this afternoon. Thank you, Father, that you have given us this humble time to deliberate on our stocks and our operations. We pray that, Father, you may be with us, you may guide us during the session till the end. Thank you, Lord, for this is by your name we pray and believe. Amen.
Amen. Thank you very much, Maggie, for leading us in a word of prayer. So allow me to share my agenda just very quickly, or the agenda for the day, sorry. Okay, so just give me a second. But I already had it open. Not seeing it. Oh, yeah, it's here. Okay. So confirm you can see my agenda, either Magdalene or Otieno. Finally confirm you can see the agenda.
Yes, I can see.
Okay, thank you. Right, so this is the this is our agenda for today. Of course, we intend to take 2 hours if possible. We really don't intend to stretch beyond there. And I'd already mentioned today we'll be discussing about the appointment, the service queues, billing, and of course we'll also be able to look at the billable services. Our training objectives: one is to be able to showcase how to configure the various billable services in KenyaEMR3.x. We should be able to also provide a demo on the bill creation, the bill processing, and of course how the payments will be made using the various options, like for instance, if it's insurance, if it's M-Pesa, and all that stuff. So we'll be able to just take you through all those details. Sorry. And then we should be able to also illustrate patient appointment management and service queues in KenyaEMR3.x. Our first part is just to do some bit of introductions. I'm not sure who is in the call, but I'll just quickly look through and see whether we have anyone sitting in from USG. And then I know Dr. Lily may not be able to join us because she's engaged, and also Rose, who is sitting in for her, is also engaged. So, but I think we just proceed. Not that we have their blessings. To just proceed with these trainings. Our first part of presentation, which basically is an introductory bit, is by Otieno. So Otieno will take us through an introduction to the billing, the appointment, and queue management. So this is a slide deck, basically to just give us a rundown of what we intend to do and just prepare us for what to come up in the demos. And then Magdalene will take us through the billing configurations, the billable services, and bill waiver process. She'll also continue to take us through the payment workflow, of course, just picking up from the configurations bit, just looking at the billable services. Then how do you then create the bill, then process the bill, and finally make the payments. Then Otieno will close that for us with another demo on patient appointment and service queues. After that, and I really want to request that you give us a feedback. This would really help, especially when planning for future trainings. So I'll be sharing this. I'll be sharing a link for you to give us some quick feedback. It's not a very long one. Just give us some quick feedback on how we can improve this. If there are any areas that you feel we need to improve on, if there are any areas that you think we need to work on, please feel free. You will build us, and we'll in turn be able to build you if you give us what I would call honest feedback. So we'll really appreciate you in providing that feedback. So kindly, all the participants who are logged in, please make sure you fill this form. So I'll be sharing towards the end of our training. I know last week we shared, but in our last training we shared, but by the time we were sharing, most of the participants had dropped off. So we're really requesting that we stay in till the end of our training. Then finally, once we are done with, of course, just giving some quick feedback, we'll be able to close and also give you an opportunity to ask any questions. However, in the process of our training, during the demos or during the presentations, if you have any questions, you can utilize the chat. Just ask those questions, and we have a team that is available to respond to you. However, that doesn't stop you from, of course, just holding to the end, so that we can also give you an opportunity to ask your questions. So basically, I think that's what we intend to do today. And having said that, I want to just check. I don't know whether we have our colleagues from USG, anyone from USG, either DOD, CDC, sorry, USAID, at the agency level. I don't know if there's anyone. Kindly raise your hand so that we can give you the mic to say hi to the team and just make a few remarks. Anyone? Fine. I guess probably maybe they'll join later. So allow me then to welcome Otieno to take us through the first part of the presentation. So Otieno, over to you. Thank you from my end. Otieno, take it up.
Thank you very much, Songok. Please confirm if I'm audible.
Yes, you are loud and clear. Proceed.
Okay, so yeah, I'll just take a few minutes just to kind of provide a quick context on today's sessions. So just like Songoka's already said, we are looking at 3 modules today in the facility-wide KenyaEMR. So the first one will be the billing module, where we are going to just look at the workflow in the billing module. How do we set up the billable items? How do we process a bill? How do we waive our claim? So that will be an exciting session again, also on the demos that will be led by my colleague Magdalene. Then we are going to also look at the patient appointment management, as well as the service queue management. Yeah, so just to start us off, so we are going to start with the with the billing module. Yeah, so I think everyone now is aware that KenyaEMR now supports almost all services within the facility beyond HIV services that it has supported for the longest time. Yeah, so one of these key modules that are meant for facility-wide is the billing module, and also centralized appointment and queue management within a facility. So we are going to take you through that through navigation end to end on how we are able to create a bill process and finalize the bill. Yeah, so so the first thing under the billing module is just a bit of the introduction. Yeah, so what is this billing module within KenyaEMR? Yeah, so by definition, it's simply a module that is integrated within KenyaEMR that helps to automate financial processes in the healthcare settings, where the bill could be created, paid conveniently by the patient, and also all these actions around the billing can take place. And ultimately, it also helps the facility in terms of monitoring their revenue over time through various dashboards. And the purpose of this is clearly to streamline the financial operations, which again, because of the automated nature, it reduces the administrative workload, and it minimizes a lot of transcription errors, especially where we are talking about figures. Yeah, so the key features within this module include the automated invoice generation for patients. You could process payment and track over time how the facility is doing in terms of the revenue collection. Actions of bill waiver and claims management are available, as well as the ease of configuring the billable services and the commodities within the system, where you'll be able to specify which commodities or which services are being billed, services. Yeah, so some of the key features is the patient registration and billing, which kind of directly links the patient registration data with the billing information. So you can follow this patient right from the time they walk into the facility, where the bill is being generated. So there could be a bill at the consultancy. There could be a billing at the when they are registered at the facility. Yeah, so there could be several points where the patient where the bill could be generated, including the lab and also at the pharmacy. All that is linked to the patient profile. And then there is the aspect of the payment processing, where the cashier is able to provide different payment method to the patients, including cash, mobile money, insurance, and even Safaricom, direct Safaricom SDK, where you just pick the patient's mobile number, and all they need to do is to put in their PIN, and the money is deducted from their mobile phone. So all that is available and is convenient for patients to be able to pay their bills through those options. Then there is the aspect of the reporting and analytics, where the facility is now able to kind of generate their report, like the revenue report, and also see over time how they've been doing in terms of the revenue collection. So there are dashboards, above site dashboards, and also facility level dashboards that can show the facility how they are doing in terms of their their revenues. And I've talked about the waivers and claims management, which is provided within the system. So what are some of the benefits of the billing module within the system? So one, it reduces manual entry and improves efficiency. And also it provides faster processing of patient bills and also on claims as well. And it enhances accuracy by minimizing the transcription errors. And also such errors may also affect the claims due to incorrect information. Another one is now better fiscal management, where we have the real-time data on financial history and trends, and this can help the facility in managing their revenues better and also streamline their budgeting cycle, because they know what they collect over time and they know what they can project over time. And lastly, under that, there is that aspect of the patient satisfaction, where there is a lot of transparency in billing process, and that improves trust between the facility and the patient, and also the fact that the cashier is able to access billing information like on a click of a mouse button. That brings a lot of efficiency, and at the end of it, patient will have quick turnaround time. So some of the challenges that we could talk about in terms of implementing this module is just a bit of the customization needs, because if you go to any different facility, they'll tell you that we needed it to be like this, we needed this one to be like this. So you realize there's no like a standardized way of doing it as a country, but we are trying to make it as generic as possible so that this module benefits all the facilities within the country. And again, also for the facilities that are already having some system, let's say Medibus or any other system to manage their revenue collection, integration is an issue again in terms of now, how does that facility move from that system to this system without losing the historic financial information? So that is also a bit of a challenge. And again, user capacity gaps, that I think is an ongoing thing, but we are trying as much as possible to ensure that we train users, we train the TOTs, so that you have this information on how to use the module. So the second module we look at today, and how time will allow us, is the patient appointment management. So under patient appointment, this features it's a feature within EMR that allows the healthcare provider to manage patient scheduling centrally and efficiently. So a bit of history on this. Previously, we had several encounter forms across different programmatic areas. And for every form, there was a field that requires you to enter the next appointment date. So you'll find that you put the next appointment date on green card, you put it on a different form. So there were several places where you would collect the patient appointment form, and it was creating a lot of chaos when you want to really monitor and see who is coming for what service at a different point in time. So with the introduction of the centralized appointment module, this kind of provides a centralized way to manage all the appointments. So the provider only has one point to enter the appointment, whether it is a green card, whether it is a clinical appointment. He only has one place where they're going to capture the appointment details, so which is great and also efficient for in terms of patient appointment management. So some of the key features on this is the centralized creation of appointments, a comprehensive calendar that helps the facility kind of forecast their workload and plan accordingly, and also having this integrated within the patient records, where you are able to link the appointment and the patient, and you are able even to generate like a line list of the patients that are expected on a particular day. So that's a great feature. And some of the benefits include the enhanced management experience for these appointments, as I've talked about, the easy centralized appointment management, and also reduced efforts in tracking appointment across different encounters. There is that improved clinic efficiency, where the clinic is able to load balance the appointments and know which are the heavier days, which are the lighter days, and plan accordingly. And again, because of the reminders that come out of this through some of the applications that we support, like the Ushauri and Nishauri, there is a reduction in terms of clinic appointment, missing clinic appointment, because the patient can now be reminded accurately on when they're expected in the facility. And also the availability of the data and the calendar that I've talked about, where the staff are able to identify the peak days and also be able to optimize their staff's allocation to prepare accordingly. Yeah, so the last bit of it that we're going to look at is the service queues, which basically is a model that helps manage patient flow within the healthcare facility. And it does this by organizing and helping to prioritize service queues and also optimizing the operation at the facility level. So this kind of reduces the patient waiting time because it is on the basis of the first come, first serve. And this kind of streamlines the way the patients are seen within a particular visit. Yeah, and some of the key functions for the queue management module, one is it provides like a digital queue management feature or function, and the real-time status update on patient service location. By just a glance, you'll be able to tell where is this patient. Are they at the triage? Are they at the clinical point? Are they at the lab or pharmacy, blah, blah, blah. So you'll be able to really tell that in real time. And that also helps in kind of easy prioritization of patients, especially who need critical or urgent attention, where you are able to say, this is an emergency situation. So the moment you queue a patient as an emergency situation, they are floated up on the queue list. So that means they come on top. That enables them to be seen very much faster as opposed to a normal patient. And again, also, I've talked about the efficiency movement of patients from one point to another, because when a patient is done from one service point to another, the clinician or the user at that point is able to say, now this patient is going to the consultation room. The moment they move that patient to the consultation room, the clinician at the consultation room will see that in their queues, and then they'll be able to call in that patient. So it's like a very streamlined kind of seamless process where patients can be able to move. And again, a very nice addition on it is the call out or the signal feature, where the system can call out a particular patient and say you are required to move to room A or room B, whichever the room. So that is also a very great feature. So some of the advantages is the improved user experience through the centralized appointment and management of all the queues. Also, yeah, this seems to be repeating what we have said on the appointment management, but generally it streamlines the patient movement from point A to point B within the facility. And that kind of creates fairness and also patient satisfaction, so that they don't feel like somebody came behind me and they're being seen. Yeah, because of that first come, first serve kind of feature in the system. So that's a bit of a summary around the three modules. So I think I'll just pass the mic straight to my colleague Magdalene to take us through the first bit before we move forward. So I want to give it back to you, Songok. Thanks.
All right, thank you. Thank you very much, Otieno. Just for those who probably may not be aware, Otieno is the capacity building lead under the KenyaEMR3 project, and is the one who's been taking charge of most of these trainings. So thank you very much, Otieno. Like I mentioned earlier, This first part was just to whet our appetite, just prepare us on what comes up in the demo, because we couldn't just go through the demo without probably just taking you through some of the features, looking at some of the advantages, what exactly are you supposed to do. And what we will do next now is to take you through the actual work within KenyaEMR3 so that you're able to appreciate some of those enhancements. So Magdalene Madeka will take us through that bit. So Magdalene is a business analyst who is also working under KenyaEMR3 project. So Magdalene, over to you.
So good afternoon, everyone. So allow me to share my screen. So kindly confirm you are able to see my screen.
Yes, I can, Maggie. Proceed.
Okay, thank you. So I'll be taking you through how to do the billing module. So first, before we do any billable or we do any billing, we need to first have the billables configured. So this is the landing page for the KenyaEMR homepage, where the login credentials are according to the role that you are partaking in the facility. So mine will be an all-round, so I'll be able maybe to do most of the roles, but most of the things that I'll be presenting today, the clinicians are not able to see, and also some of the facility members because of the way the roles are configured. So allow me to just log in. Then after you are logged in, you are able to choose your login location where you are able to perform the different tasks that you want to perform. So I'll be logged in the main hospital, where this is where I'll be performing my task from. Then we have the KenyaEMR modules, where you'll be able to see all of them if you are an admin, but according to your user roles, you are able to see what you're supposed to do. So I'll just go ahead to do the billing. So for the billing person, they will only be able to see only the billing module. So first, before we go to the billing module, we'll have to configure the different services that we will be billing them in our module. So the billable services, you'll be able to get the billable services from the KenyaEMR module, which is on your top bar on the KenyaEMR modules. And then we have the billable services, which is a module under the KenyaEMR modules. So the billables are only available to an admin level. So only an admin level is able to get the billable or configure. So when we are configuring the billables, we only give the admin, or the administrator chooses the people who will be adding the billables to the hospital, because we know the billables have a trust issue. Someone can just decide to today just go and alter something or change. So this is more of an admin level, where we have, this is the billing interface. So because this is a test instance, you'll notice that we have a list already here, which people had played around with, but on a new slate, you won't have anything. You'll just have the actions, where you'll click on the actions and then you start configuring your billable services. So for the billable services, we have the actions, and then we have this drop down here where we have the additional actions. So the additional actions, we have a service and a commodity. So we know the different has different services and has different commodities that are added prices so that they are utilized in the facility. So we'll start with a service. What are a service? A service, these are the things that we give to the clients, like when you are registering, a lab is also a service, something like the X-ray, that is a service. Then we have the commodities, where we have the pharmaceuticals and the non-pharmaceuticals. Those are the commodities which we have in the system that we are able to configure the different prices of the commodities that we are dispensing out to our patients. So I'll start with adding a service. So when you click on adding the service, we have a pop-up where we have a form on how to create a billable service, where we have the service name, which this is the service that we want to configure into the system. So I'll start maybe with a consultation. We know we always have the consultation. Then we'll go to the cascade of how we do it in the hospital. So I will just maybe do an OPD and just type in. So this is dependent on what we have in our facilities, because the different facilities have the different services and the amount of money which they are configured. So you'll find maybe for Mlango, they call an OPD consultation a different way rather than the way Machakos calls it. So this is dependent on the list that you have in your facility. So it's consultation. Then you can have a short name for the service that you are having. So allow me to just say accounts. Then we have a service concept. So the system has a concept which these are the unique numbers or the unique codes for each and every other service that we have. So we are provided with a list here, which this list is the one that you are supposed to map to the different service names that we have. So this list mostly is a one-to-one match with what we have as the services. Like for OPD, we have the consultation. So you'll find a service concept, which is called the consultation fee, which this is where you map the clinical consultation. Then if it's a lab, you'll have the same, maybe you are doing a rapid blood sugar or a random blood sugar, you'll also have that unique concept that will map to it. So we have provided a list of all concepts or all unique numbers that you are able to map to these services so that you can be able to get the prices. So allow me to look for my clinical consultation. So I'll just look for consultation. So when I type in consultation, you'll be able to see that all the consultations or anything under consultation is coming up. So we want to map it to the consultation fee. So remember the service name is OPD clinical consultation, and this is the same as consultation fees. So you'll be able to map it to the consultation fee. And then we have the service type. So what is the type of the service that we are mapping each to? So we have the different service types where we have a lab service where we'll map all the services that are under the lab. Then we have a pharmacy service, which will also map all the commodities to the nutrition service also. So all these are dependent on all the service types that you have in the facility. And this is also added all configurable. If you have more of the service types that you offer in your facility and you find it is not here, it is also configurable and added so that it matches whatever you have in your facility. So here, this is under clinical consultation or registration. So I'll just comment, say that this is under the registration. Then we have the service status. The service status is an on or an off. So the on, when you do the on, means that you want it to be seen in the interface. In case today you are not offering a clinical consultation for this service, you just come here and you put it off. So this means that you won't be able to bill anything that you've put it off. So this helps you that you don't just come and delete, but maybe in case for this service you're not offering it anymore, you can just come and off it, and then when you start using the same service again, or the service now is available, maybe an x-ray or maybe a lab which you don't have the reagents, and then you want to, you have already ordered for them and they're back, you just come and turn it on so that it is, you are able to see it on the UI or someone is able to bill it. Then we have the different types of payment methods where we have, sorry, let me just increase this. So here we have a cash. When you hover around, you are able to see. So you have a cash, you have insurance, and you have mobile money. So these are the different payment methods that are being offered. So we know different facilities offer different payment methods through their services. So you can click, maybe you want this service to be a cash. And by cash, I want to be paying a consultation fee of 50 shillings. And then you can add more payment methods. And maybe when someone comes with an insurance or mobile money, they are able to pay maybe at 150. So you are able to configure different payment methods according to how you do it in your facility. And also maybe say when someone pays mobile money, they also pay 50 shillings. So you are able just to configure according to how your payment methods are in the different facilities that we have. then you can be able to save. And then after you save, you will see a pop-up that the service has been created successfully. And then when you search here, it was an OPD, you are able to see that you have an OPD clinical consultation. It is enabled, it is under service type registration. And by cash, it is 50 bob. By insurance, it is 150. By mobile money, it is 50 shillings. So you are able to see that. Then I'll also go and add an additional service, maybe a lab service. So I'll type in my lab that I want to add. So I'll just say maybe random blood sugar. And what is the short name of this? Maybe RBS. Then I'll just come here and where do I want to map it to the concept? So I'll just type in random blood sugar to my concept dictionary, and I'll be able to see that I have the random blood sugar. Then I'll type it here. And what is the service type? This is a lab service. And then what are the payment options? So I'll be able to add the different payment options. So maybe I want it to be mobile money. And when it is mobile money, it is 100 shillings. And I want also the insurance people, the NHF or the SHA, to be catered. And maybe for SHA, it is 150 shillings. And then I'll continue and save and close. And I'll be able to see it. When I look for random blood sugar, I am able to see the random blood sugar. Yeah, that it is a lab service, and by mobile money it is 100, and by insurance is 150. So this is a universal search where you are able to search among all the pages that we have. Right now you can see that we have 2 pages, and that is on the other side. So in case maybe someone else had added a billable item and you are not sure if it is available, you just come here and you're able to search that, so that we don't have like duplications of the same service. So it is always good that if we already have configured our billable services, we just come here first and search, so that we don't duplicate it. So yeah, then I'll continue next. We have added a service, so we are able to give a service. Then I'll add a commodity. Commodity, these are things like drugs or the non-drugs. So I'll start by adding maybe a drug. So yeah, when I search here, I'll be able to get my drugs. So I want to add metformin, which is the 851. So I'll just type and search that and then click. So this, for the commodities, we have provided all commodities according to the KMSL 2023, the way they are presented. So it is easy for you just to come and look at it and just see the formulation and just click on it and then add the payment method. So it is just the same as you are adding the service. Then I say for insurance, I want to be selling my metformin at maybe 10 shillings. And I'll add another payment method. So maybe for my mobile money clients, I want to dispense this at 5 shillings, and then I'll save and close. I'll also add another commodity. So allow me to add a non-drug. So I'll look for a surgical blade. So here is a surgical blade, maybe with handle size 11, the same. So when you just search here, you'll be able to find all the non-farms that we have in the facility, and you can add prices for them. Then I'll just say here, maybe for insurance, I want someone to be paying a surgical blade at maybe 100, and for a mobile money, I want them to be buying that at 50 shillings. So it depends on how much your finance bill is at as per the county or at per the different clinics, then you are able to save. So that is how we are able to add a new commodity or a new service. Then we have all this, where this is the line list of all what you have added as a billable or in the service. So in case maybe the price changes and we want maybe to just come here and change. So when something changes the price, you don't delete it or disable it. You just come here and edit. So you'll notice that we have the 3 dots here on every line of the line list. You notice we have the 3 dots where this is the options. So when I click on the option, it brings an edit. And when I click on the edit, it gives you what already you had pre-entered. And then you are able to see maybe this is the payment method that you had chosen. And I just want maybe to change and say maybe I want to have it at 100 shillings or the price that has changed, and then you save and close. So you don't delete it, but you just come and edit it. So I can also do another one, maybe for a drag. And then when I click here on edit, I'm able to see that I had configured furosemide at mobile money only, and it was 15 shillings. And maybe the price has lessened, and then maybe it is maybe 13 shillings. And I can add that. And also maybe we have added another payment method, maybe for the same drug. And I'll just come and click and say maybe we have insurance right now that is SHA, and this is being sold at maybe 20 shillings. So I'm able to edit that and just save and close. So this mirrors any other time that you are adding or you are using the billables. So that is how we are able to add a billable, a service, and also we are able to edit the same. So after this, after we have been able to add our billables, now we can now have a patient where now we'll see how we are able to tackle the different billing services. So allow me to go back to the KenyaEMR home where we have a line list of our patients. So I'll just use my random patient. So I'll come here and look for my patient and just tackle the different ways that we are doing the billing. So I have Tessie, who is 30 years. Then we want to start a visit. So the billing workflow starts when you have a patient who came in and they are starting a visit. So when starting a visit, I'll click on the start a visit and I'll see the visit start date and time. And if a patient has any upcoming appointments, you'll be able to see them from here. And then my visit type. So for my patient today, they're an outpatient. And then the aspect of billing enters here, where we have is the patient exempted from payment, a yes or no. So we have the different exemption categories, which are configurable according to our facilities, the way they operate. So some have in prison, others under 5, the CCC, refugees or above 60 years, which is configurable according or specific needs of our facility. So you can add or remove what you don't do in your facilities, what you don't exempt. So you are able to add the exemption category and also minus the exception category. This exemption category works in hand with all the services and also the commodities that we have. So when I say someone who is under 5 is an exemption, this means that they are exempted from paying anything that is a service or anything that is a commodity. Also, it is configurable. We know maybe an under 5, maybe they are not paying the consultation, but they are able to pay maybe for the drugs. So this is also configurable according to that specific need in your facility. Maybe for my under 5, I don't pay for consultation, but my under 5s pay for a lab test. So you are able to see that they will not be able to pay for a consultation, but they will be able to pay the lab or any drug. So this is when you are deploying or when you are taking up the KenyaEMR, you give that as a specification, and then that is configured according to your specific need for that facility, because we know the needs are different for each facility. Then we have those patients who are not exempted from the payments. Then we have a no, and then we have the different payment methods. So here you'll specify how you want your patients to pay. Do you want them to be paying by cash? Do you want them to pay by insurance? Or do you want them to pay by mobile money? So I'll start by a use case of an insurance. When you click on the insurance, you'll have the insurance scheme. Where the insurance scheme, we have the SHA stroke the SHIF, which I think by the directive, we are maybe transitioning this to the 1st of October. And then we have the NHIF, the Linda Mama, and the private insurances that we have. So the system is able to be configured so that they are able to use. So when you click on SHA, you'll have here a policy number. So this is linked to the claims authority, where when you enter the policy number, you are able to authenticate that this patient policy number is correct, and you are also able to get the benefits that this particular patient has. So this is a configurable where when you enter the policy number, you are able to get that patient's detail. Then allow me to come back to mobile money. So I want us to do a mobile money. So when I click on the mobile money, you will get the services. So here, every other billable service that we have configured comes here in this billing line list, where some of the times someone might be coming for a lab direct, and maybe you just want to say maybe they are just going for a random blood sugar, or you just want someone came to your pharmacy and they are only paying for a drug. You are able to just tick it from here and not start the whole visit where they'll go to the doctor and do all that cascade. But for today, I want us to just do a cascade. So we had our OPD, clinical consultation. So you just type in and you are able to narrow down to what you are looking for. So we'll get our OPD clinical consultation, and this is what our patient is coming for. And then we have the queue locations. This Otieno will specify more, so just allow me to skip this, and then I'll just be able to start a visit. So when you start a visit, you'll notice that we have something that shows you that that patient has been billed successfully. And when just a minute, and I want to duplicate this. Even before I duplicate, you can see that the patient billing alert comes up, and you are able to see that the current patient has a pending bill, and then you are told to advise that patient to go and settle the bill. So this will come when now someone else next comes to serve this patient. They won't be able to be served unless they have been cleared this bill. So now after creating this is one way of creating a bill through the starting a consultation or a service. So I'll cancel this and then go to the KenyaEMR3. Now where we'll go to the billing, and now we'll be able to see the billing. So this is the landing page for a cashier, where they'll be able to see the billing, where we have the cumulative bills, the pending bills, and all the paid bills. So by default, we have a line list of the today's bills. These are all the bills that were raised today. So the cashier will be able to come and call your name or the client's name, and then just so able to navigate on them. So we have our patient was Tessie, who has a bill. Then I'll just come here and just click on that. Also before that, maybe if you don't know who, you don't have like someone, only one person at the cashier desk, and maybe they come and you are able to filter their name, or just type in their name, and then you are able to filter for them, just to call them out according to maybe the queue number or something of that sort. And then we have also, you can also have like a filter by maybe only the pending bills. So you can decide to have the today's bills, or just filter just to get only the pending bills, so that it makes easier for you just to call out the next person. And also you can filter by any bill that has been paid, and also the posted bill. So the posted bill, I come to it later when we are doing the bill waiver. That is when we'll understand more of what is a posted bill. So a posted bill will be mostly something that you have paid partially. That is when you are able to get it into the posted bills. So I'll just come and have our client, who is Tessie. So the cashier will click on Tessie. So when you click on Tessie, you'll be able to see the name of the patient and where they are. So you are able to see the total amount tendered, if any, then the invoice number and the date and time that they came in or the bill was posted, and also the invoice status. So the invoice status that by now it is pending because it has not been paid. And then down here, you'll see the line items of what our patient has been sent for. So you'll notice we only have one because we only did an OPD clinical consultation, and the bill code is the invoice number. It is number 42, and then the status is pending and the quantity is 1 and the price is 50 shillings and the total is that. And then you are able to print this invoice just in case maybe you want to give them out. So this is how the invoice looks like. So you are able to see that the invoice number, which is here, it is Tesi, and then they are billed to where and what they have been billed for. So you are able to see like this is an OPD, and then the total is 50 shillings and the status is pending and all that, and who created it at what time. So this, you can print this and give it to the patient, or maybe for the SHA, this is what maybe you attach to the claims. Then allow me to cancel this and process. Then we have the different payment methods. I'll first start with the M-Pesa payment. So allow me to click on the M-Pesa payment. So for the M-Pesa payment, we have the STK push, where maybe I'll just click on my number, and then you'll enter the patient's number, and this allows you also not to pick this number from maybe the registration form. Maybe someone else is paying for the patient. You are able to type in, and also the bill amount, and then when you click on the initiate payment, this sends an STK push, and then this is waiting for the user. So this will give a pop-up to whatever number you have, and then like now I've received a message to just enter my PIN number. So this will be waiting for the user to pay. So if the user doesn't pay within 1 minute, or some minutes, it automatically cancels. But if the user pays, allow me just to maybe deduct and say it is 50 bucks. So you see it won't be able to initiate the payment because it expects you to pay the full amount of money. So you see it has failed because I didn't pay. So if you don't pay according to the specified time, it just automatically fails. Then maybe I can just come here and cancel this. So I didn't give my PIN number and it failed. So this is an automatic where right now you are able to get the STK push, where you just key in the number of the person and then they get a pop-up and they're just able to enter their PIN number, and then that is processed. Then we have the claims, where we have the process claims, where we'll have the claim summary. This is for the SHA and the SHIF, where someone will just come here and get the amount which is to be claimed. So this is 50 bob and it will be claimed. This is the date, and you are able to get the items. So if the items are many, they'll just come here as a line list, and then you are able to tick. Then this form is pre-filled from our clinical encounter. So this claim will be maybe the last thing that someone will be attaching so that the NHF or the insurance will be able to pay. So where we have the visit type, the facility, when was the treatment started, and the diagnosis. So the diagnosis, the provider name, the claim code is from now the integration with the claims, where you are able to get an automatic claim code for this patient. And also you need to write an explanation and also the claim justification, and then you are able to click and process, and this now goes to the claim management, where we are able now to claim and also proceed with care for the same patient. Then after that, I just want to discard this claim, and now allow me to go to the another payment method. So I'll come here and select my payment method. So I want to pay for my patient as a cash, so that we proceed. So I'll just enter the amount that they are giving me. So it is 50 shillings. And you'll notice after I entered the 50 shillings, that the amount just from the amount due to the amount entered, you can see the difference. So it is abstract itself. So you can see when I do the total amount, you are able to see that when I add like it is more than the amount, you see that you are not able to proceed with the payment. So you will not be able to process the payment. So the payment, when you overpay, you are not being able to process the payment. When you underpay, you can process the payment and continue, but when you overpay, you are not able to process the payment. Then allow me to process my payment. So you'll notice that this gives you the bill has been paid, and then the button for the print receipt activates automatically. So allow me to just open this. So this is the receipt after you have been able to process the payment. So you'll notice that this is Railways Dispensary Kisumu, and this is Tesi, and what Tesi was ordered for, this is the OPD consultation, and they paid by cash and they paid by 50 bob, and then you can see they were served by who. So this is the provider who served them. So this is how the receipt looks like, and you are able to print this receipt in our thermal printers. This is the thermal printer size, so it is, you are able to print it and give it to your patient. Then now allow me go back to our patient. So I'll come to our patient and just show another way of how you can raise a bill. So allow me to look for my patient, Tesi. Here's our patient. So you notice that after you've paid, you are able to proceed. So there are different ways in which we can raise a bill. So first one was by doing the consultation. This is when you are checking them in. The next one is when you are offering them a service. So I want to offer my patient a service, which is now maybe a lab service. So for the lab service, I'll just come to the order basket, and then we have a lab order. Then I'll raise a lab order so that I am able to raise a bill. Remember, we had added a random blood sugar as a billable. So when I click on the random blood sugar and I click on the order form, I am able to say that we have a random blood sugar with the different payment method. So you are able to see whatever we configured, you are able to see here. So for a mobile money and also for an insurance, which is different. So you'll see that the random blood sugar for a mobile money is 100 shillings and for an insurance is 150 bob. So I'll click on that and maybe I'll give the reference number. This is which the OPD number. And then I'll give any instructions I want to the lab or none, and then I will save the order. Then you can add as many as labs or services as you would want to add for a patient. Then allow me to also add a drug as we are raising this for the same patient. So if we had added maybe a metformin, so allow me to look for metformin. Yeah, metformin, I think it was the 851. Yeah, you are able to see that the unit price is 5 shillings. So this is what you configured in the billable services. So when you are giving your patient the order, you are able to tell them that atalipa shilingi tano, or according to whatever price that has been configured. So just allow me to raise this dispensing so that we are able to pay it. Then is an oral, and maybe the frequency is twice daily, and I want to give it maybe for 5 days, and I want to dispense 10 tablets so that you can see how that will come up in the billing. Then I'll now do those two services. I'll do one service, which is the random blood sugar, and also give one drug, and then I'll sign and close. Oh, sorry about this. Allow me to repeat this. I think the system is having a challenge. So this was random blood sugar. I'll click on the order form, and then I will order this. And also I want to add a drug. So allow me to look for my drug, which is metformin, 850. And I'm able to see that it is 5 shillings, and I'm only dispensing maybe it is 1 tablet. And they're taking it as an oral, and I'm giving them twice daily. And I want to give them for a duration of 5 days. So this equates to me dispensing 10 tablets. Then I'll sign and close. So you'll notice that we have placed the orders. So this person is now able to go back to the billable, the billing. When you go to the billing or to the orders, you are able to see that whatever this was raised, and you are able to see that. So allow me to go back to the KenyaEMR3 and go to the billing, and you are able to see what TESI has been raised as a bill. So we are able to see that we have the random blood sugar and we have the metformin, and then it has multiplied according to how the bill was set. So if you look at metformin, one was around that much, and then when you click, you see that we are dispensed for 10, so the 10 is 100 shillings. So I want us to pay one by M-Pesa or cash, and then we'll now be able to waive the other. So allow me to just click that I want to pay for the random blood sugar alone, and then just add the payment method so that it will be easier and blocker. So I'll just say this is 100, and then I'll be able to process the payment. So after that, one will be pending and the other one will be paid. So when I come here back to my line list, I'll be able to look for the posted bills, and I will see that TESI has this amount. So you'll see that one is paid and the other one is pending. So when we are doing the bill waivering, this one now will be able to maybe pay one from the cashier or pay partially, and then they'll go to the admin and they will be waived. So allow me just to copy this and just show you how the bill waiver goes. So I'll copy this ID, and then we'll now go to the KenyaEMR modules. Also, the waivering process is also like more of an admin level. Not everyone is able to waive. Then we'll come to the billable services, and then we'll come to the bill manager, where you are able to search now for your different patient or the patient that you want to waive for. So when you click on that or you type in that, you'll see our patient who is TESI, and you'll see that we only paid some amount of money, and out of the amount that the total amount was 250, and this was the amount paid. So that means we can waive the rest of the money. So when you click here, you are able to see that we add a random blood sugar and we add a metformin. So these are the bill items that this patient was raised for. So I'll just click on the waive bill, and we want to waive the 150, which is remaining. So you are able to waive the total or the partial amount. So I am waiving the amount which was not paid, which is 150 shillings, and then I'll click on post the waiver. Sorry about this. Maybe this didn't waive the waiver because whatever I am I'm not able to. I logged in with my credentials and I'm not able to waive. So just allow me to come in as an admin, just a minute, and show you this. Then I'll go here to the billables, and I'll just look for my patient who is TESI, and then I'll just come back here and I want to pay the 150 and then post the waiver. So I think this is having a problem. We'll look into this, but this is how you are able to clear the waiver or post the waiver for this specific patient or a client. Yep. So that is how you waive. Then we have another type of billing, which is the ad hoc billing. So the ad hoc billing, allow me just to take on Lillian, where it is a one-stop shop and you are the one who is raising these bills, so, or clearing the bills, so you don't want like to raise the different bills. So I'll come here to the modules and we have the billing, and you are able to record the patient billing from here. So you are able to add all different billings from this UI. So maybe I want to add them for a malaria smear. So you are able to see the malaria smear here, and then you choose the method, which this method gives you the method that has been configured in the billable services. So for the malaria smear, this was configured as a cash only. Then you can add more billables that you want to add for this client. So maybe I'll add the metformin. Then the metformin, you'll notice that we have the different payment methods which we had configured, which we have, it is an insurance and a mobile money. So I'll click according to what the patient is using to pay. So maybe my client is using mobile money and this is 5 shillings. If they were using the insurance, you'll notice that that changes. So I'm able to say maybe they are taking 10 tablets of metformin and they are paying by insurance, which by one item is around 10 shillings. And you are able to get the grand total. And maybe you can add as many services that you'd want to give this patient. So maybe this is a random blood sugar and I want to say what they're paying with. So if they're paying maybe with insurance, you'll get this is 150. And if they're paying with mobile money, that is 100 shillings. Then you are able to raise all the bills at once for this specific patient. If it is a one-stop shop that you are the clinician, you are also the one who is raising the lab, and also maybe you are the one who is dispensing the drug. This will mostly apply for the level 2 facilities, which we only maybe have, or we are limited providers. And also maybe they are the cashiers, depending on the setup of that clinic. So you are able to raise a bill, a one-off bill, or a bill one-off for a particular patient. And then I'll just click and save and close. So you are able to see that this specific patient has this, and then they'll now be able to go and pay. So I'll just want to take their ID number. So their unique number, just a minute. This was Lillian. Just copy and maybe just now try and do the waiver as a whole. So I'll go to the bill and then come to the bill manager and allow me to change the location and be in the facility so that I can continue. Then I'll get my client here, who is Lillian, and then I want to waive this bill. So let me waive. Maybe I want to waive 3,000. Then I'll click on post the waiver, and then I'll go back now maybe to my bill. So you can waive partially or the whole. I'll now go back to my billing and see if we were able to waive for Lillian partially. So when I click on Lillian, I will see that this was tendered amount. So we tendered 3,000, and then I'm now able to process the other payment, which maybe I'll say this is cash, and I want to process the rest, which is 2,200 by maybe mobile money, and then I'm able to finish and process that payment. Yeah, so now you are able to get that by how they did it. So when we come again to the billing, we notice that we'll have all this. So what the cumulative was and also how the bill was paid. And then when we come to the billable, maybe this is for the admin, they are able to see the different payment history for our different clients. So we have the payment history where we see for the admins, how much was the cash that was tendered for this specific day, how much was the insurance that was tendered, how much money was on the mobile money, and how much was on the waiver for the different days. So you can here narrow down to when you want like your start date to be and when you want your end date to be. So this is by default by today, where you'll see maybe Lillian paid this amount of money and the service that was given, and then you can narrow down and just see apply the cash filter and you see what was paid per cash, and maybe we want just to get and see what was waived per survey, and then just get that Lillian was the one who was paid, and then Tez was paid for paracetamol. So you are able to granulate what exactly was being waived or what exactly was paid for, and which patients were waived or which patients paid the cash, and vice versa. So you are able to see this from the payment history. Yeah. So thank you for your time. That is how you are able to configure the billables and create a bill, and also waive the bills, and also how the admin is able to see the different billables as the way they have been transitioned, and also they have been paid in the summary. Yeah, I take it back to Songok. Thank you.
All right. Thank you. Thank you very much, Magdalene, for that walkthrough. That is quite something. There's some good work that has gone in there. There are so many questions that have been raised on the chat, and I want to request the team to respond to some of the questions that you're able to respond to. At this point, I want to welcome Otieno to take us through the last demo, that is the patient appointment, and how to manage the queues. So Otieno, take it up. Then after Otieno, we will be able to take a few questions. But as Otieno will be presenting, I will share the link for you to be able to give us some quick feedback. So Otieno, you can take it up.
Yeah, thank you, Songok, and thank you, Magdalene, for that presentation. So I think I'll just spend like very few minutes to just take you through the appointment management. So Songok, confirm if my screen is visible. Let me just make it bigger.
Yes, it is feasible. Yeah, but you need to make it bigger because the print is too small. People may not see. If you can make it bigger, that's better. Yeah, we appreciate. I can see the claps. We can continue clapping for Magdalene for the good work. Thank you. Thank you. We appreciate the claps.
Yeah. So I'll just go through this very fast. So as I mentioned when I was doing the presentation, so the system also includes appointment management module, which, as I said, is a centralized appointment management module where all the appointments from any service is supposed to be posted in. So how do you get to the appointment module? So first you log in. So I've already logged in. When you log in, this is the first page that you see. And you can also click that KenyaEMR logo to be sure that you are at home. So that takes you back home, or you can just click home where we have the mouse pointer. So at this point, we have a list of items under this, but our interest today is the appointment. So that is the appointment home where we have all the appointment. So I just want to go through some parts of this particular window that we are seeing. I wish I had a way to point, but just bear with me. I have the mouse pointer. I don't know how to change it. Maybe next time we'll explore. So the first thing is we have the different sections. So one, we have the scheduled appointment where we have the 184 here. So this shows the appointment that we have today as of 19th of September. And at the same tab, we have the number checked in today. 0 has been checked in so far. Our clinic is not open today, maybe. So that means 184 patients haven't come today for some reason. Okay, then we are going to the next tile where we have the highest volume service that is expected today. So we have the drug refill. So we have about 135 patients coming in for drug refill, which is the highest for particular day for today, 19th. And the providers that have bookings today are 2, as I've highlighted right there. Now, below it, we have different tabs. We have expected. Here we have checked in, the number checked in and the number completed. So the number expected in the list is the 184 patients that we are expecting today. The moment they come in and they get checked into the system and they start their services, they'll be moved under checked in. So we'll be having the list of checked in right there. Once they have received all their services and they move, they are checked out of the system, then we'll have those as completed appointments. So you're going to have the number that has completed right there. Okay, so the other section of it is we have the calendar up here. So you can look ahead or previous. just to see how many appointments you're expecting on a particular day. So for instance, if today is Thursday and I want to do next Thursday, how will the appointment be looking like? So I'll just go to next Thursday and click on that. Then the system will just fetch for me those. So next Thursday, we have 110, and this is the list of that. Here is the list, sorry. The list starts from here, all the way down for those 110. And the number of service, the highest service by volume is the number of patients coming for drug refill, which is 68. And the providers are those. And also I can see, I can filter by the number of, by the type of service they are coming to get in the facility. So I could just maybe say how many are coming for, let's say, let me just say clinical consultation, if we have that. Okay, since I couldn't have that. So how many are coming for cancer screening? There is none. I can say how many are coming for CWC. Yes, we have that Nayo who will be coming for CWC. So we can filter and see different perspective of who is coming for what. Okay, so again, I can return to today and also just say maybe on 29th next week, on 26th next week, how is the calendar looking like? So I can pull up the calendar and just show like every day, which services are we expecting patients to come for in our facility. So you can see from the calendar, we have different services. So we have like HIV consultation, drug refill, MCH antenatal, blah, blah, blah. So you can tell which services per day is are the patients coming for, and how many of those patients that are coming for that particular patient. Now, should you want to get a line list of the patients coming for a specific service. So let's say I want to see how many are coming for MCH antenatal on postnatal on 26th. So I just click on the number 3. I hope you're seeing my pointer. I just click on that 3, and then the system will filter that for me so that I only get the women that will be coming for their postnatal visit on that particular day. And I'm able to see a bit of their information. If I just pull down the menu, I'm able to see a bit of their information by just pulling down that tab. So that is basically how the appointment management work. And I can also add a new appointment by just clicking on the new appointment there. And I search for a patient that I want to add into this appointment. So maybe if I just say I want Mary to come for appointment on this particular day. So I just pick Mary and I just click on her name, and then I'm able to now fill in the appointment. And Mary will be coming for MCH postnatal, and she'll be coming. That is scheduled. She'll be coming on, let's say, on 26th. So I can say they're coming in for the whole day, or if they're coming in just for a few hours, I can say they're coming in on that day at 8 a.m. And then duration, maybe they're coming in for 1 hour. I can specify that, but I don't know how to do that. So I simply say all day. Then I can have the calendar on 26th just to know how many are already booked in for that particular date. So this calendar will tell me that on 26th, we have 0 mothers already booked in for that. So I can proceed and just write my notes and then say save. Okay, so if you look at my calendar, I have Mary already added for 26th. I think it is the last one below, as you can see. So we are expecting Mary on that particular day for MCH postnatal visit. Okay, so that is how it works. And as I said, whichever encounter form that is being filled, be it green card, be it clinical form, you'll be required to fill in an appointment date. Then that will pull up that form for appointment, and all the appointment will be brought here. So you'll be able to manage them centrally. Yeah, so that's the bit about the appointment management. So allow me to touch this briefly. Okay, the last bit I didn't mention is that you can download the list of appointment. Yeah, that's the thing, the last bit. So let me proceed to the next one, which is also very short, which is the service queues. I hope the screen is now visible. I've tried to really zoom it in. So we look at the service queues. So again, as mentioned, service queue is a model that helps manage the flow of patients from one point at the time of entry to the facility to the time they exit, where each provider or each user will be able to move this patient from one service point to the next. So let's learn a little bit about the interface of this. So one, we have the location here. So this will specify where I'm seated. I only want to see the patients that are in my queue where I'm seated. So if I say all, I just say maybe I'm seated at let's say I'm seated at the OPD. I only want to interact with the patient that have been sent to OPD. Okay, so I specify that. So in my list here, all the patients I've been seeing will be the patients that have been sent. That will be queued at the OPD. Sorry. So the next we have this particular tiles. One is the number of patients checked in today. Then the number of patients waiting for a particular service. So like how many are waiting for clinical consultation. So we have the 4. And then we can generate the patient list, which already we have down here, but you can generate it as well. And then we have the average waiting time here that somehow calculates the average waiting time depending on all the patients that have been seen on that day. Okay, so down below, again, we can filter. So like we can filter the patients that are waiting for clinical consultation, or we can filter by the patients that are waiting. We have the patients that are finished or the patients that are still in service, and we can also filter by the patient that is waiting. At the end of a working day, if you still have patients under the queue, means that either they disappeared along the way, they were not properly checked out, so for some reason they didn't finish up, they didn't complete their appointment. So in that case, the facility can be able to just clear the queue after establishing that all those patients were seen, or some of them didn't finish up. So they are free to clear their queue so that the following day they start from a clean slate. So that is also something that they can do. Now, how do we move a patient from one queue to another? So for instance, if let's say we have all the patients, let's say waiting for, I want to look for the one that is on triage. So let's say this patient here, Sylvia, is right now is at waiting for triage. So suppose they have done with the triage, they want to move this patient to a different service queue. So one, they can come to transition and say, let me move this patient from triage, and then they say, let me move this patient to consultation. So we could say clinical consultation here for OPD. The patient is waiting. Now, depending on the emergency, depending on the status of the patient, we could say this is an emergency situation, or maybe not urgent, or we say urgent. So depending on what the assessment on the patient is, they can choose the queue priority. So for us, maybe it's not urgent, we can just say transition, so that now that patient is now transitioned to clinical. I hope our calls will see or something. So I want to just go to OPD so that we can see our patient. I think they were called Sharia, I think, yeah, this one. So if I'm the clinician at this particular service point and I want to see Sharia, I believe Sharia is seated somewhere out there on the bench. So what I do, I click the bell. There is a bell here. I just don't know how to highlight it. But there's a bell here you can see for calling this particular patient. So if I ring the bell, then I'm able to now, first of all, interact with the biodata for this patient before I actually see them. So the moment they walk in, then I click serve so that I can start seeing them. But suppose they didn't walk in, I called and called and called, no one showed up. I can just requeue so that I go to the next patient. So at this point, maybe Sharia is available, so I just say served. Yeah, so Sharia will walk into my clinical room. I'll be able to now interact with the patient, do everything that I would want to do. Then maybe I want to transfer them to the lab. So I just fill in everything. Maybe I'm filling in a clinical encounter. Then at the clinical encounter, I'm supposed to maybe take them to the lab. So I'll be able to do the lab order, like what we have seen Magdalene showing us, where I'll be doing the lab order. And once I'm able to generate a lab order, the lab person will see them in their queue and also do whatever they need to do at the lab and post the result back. But ideally, that is how you move a patient from one queue location to another. So if I'm done, I can move this patient to a different queue location. Maybe I need to move them to a laboratory location or to a pharmacy location. So whichever queue that I would like them to go to next is what I select, and then they'll be able to be seen in that queue. So basically, that is the short and long of how the queue management, the queue services works in the EMR. Yeah, so I can also manually add a patient to a queue by just simply adding a patient to the queue manually and searching for maybe a patient, let's say Mary. So I'll just search for Mary, then I add them to a particular queue. So I'll just go through this and say they're in this facility, and the queue location I want them to go to maybe is to HTS, and then the queue service is HTS. Then I just start that visit. So they'll be able to now be seen in that particular queue where I've sent them to. Yes, so that's the summary of the two modules, the service queues as well as the patient appointment. So up to that point, I want to return it to you, Songok, to lead us into the next session. Thank you.
All right, thank you very much, Otieno. So let's give Otieno a round of applause virtually. He's done a very good job also. I think this is also very important, especially for the clinicians. In terms of managing the queues, just looking at who needs urgent attention by the clinicians. I know most of the times you would, if you sit in a facility, you will see guys being rushed in and all that stuff. So that really helps the clinicians to be able to prioritize. On issues about appointments, I think when you look at, even for instance in MCH, all clients who come in for ANC always have a TCA date. So again, this particular announcement has really taken care of that. And also in terms of planning purposes, the service providers at the facility would really be able to tell how many clients are they expecting to serve in a day. Of course, there will be some walk-ins, yes, but it will just give them a rough idea in terms of preparing the clinic, or in terms of preparing within the facility. So thank you very much, Otieno, for the walkthrough, and Magdalene for also the initial demo. So we really appreciate that. So before we go to the next session, I want to again just appeal to you to fill in the feedback online form. I had posted earlier on, and I think I can just repost it again. Like I said, your feedback is very valuable. So we really urge you to just give us feedback. This will really improve in terms of how we can prepare adequately for the upcoming virtual trainings. Right, so I think we can then open it up for Q&A. Looking at the chat, let me just start from there. I know there've been the answers that have been up for quite a while. Vivian, Gala, and Maureen. Omia, the hands have been up. We'll give you an opportunity. So meanwhile, maybe Otieno, you can plan to give them the mics as I quickly run through the chat. I know Magdalene and Adeline have been able to respond to some of the questions that were raised. Yes, so let me just allow me to just run through it. There was a question from Emmanuel Maingi that I think that has been responded to. Emmanuel Maingi was concerned about whether editing the prices of items would affect the other will affect the revenue that is being collected in the facility. And I think the direct answer to that is no. It doesn't really affect, the editing doesn't really affect what you initially had captured. Yeah, and then I think there was guidance from Olau, probably, and this is to all of us, not just Magdalene alone. And I think Olau was this is more like some TA on how we can do better in terms of presentation. So Olau was requesting if it's possible to set the mouse pointer so as to trace movement and even the mouse pointer color. So probably maybe as the mouse was moving around, most of the participants were getting lost. They were not able to follow through and see where the pointer is, which when probably you're doing your search or when you're doing your typing, they were not able to follow through the pointer. So probably this is for future Otieno. You can probably take this up. We could just help by just trying to set up the mouse, probably just changing the color, maybe use some bright color to help participants be able to quickly follow. Yeah, and I really understand. Yeah, so let me see whether there is, I think most of them was some comments. There was a question, Kevin Mugo. Yeah, thanks Kevin for the comment. There was a question about Kataboy Peter. What about facilities that don't use EMR? I think that was responded. Yeah, that was also responded. Yeah, okay. I think those are concerned. The screenshots were not visible, Otieno, but I think maybe for future we need to do better. Adeline, I think you already responded. But you know, there's a concern from Peter Nzoka from BOMO, and I think this as was raised in other forums. I don't know whether you can respond to this. In respect to issues around appointment and the scheduling. So Peter is asking, you may need to probably just make a comment on the effect on TX car numbers in facilities. I think you're aware that there's been some concerns on the same. I don't know whether you want to comment on this at this point before we proceed, Otieno. The concern raised by Peter. Otieno?
Yeah, I think I can briefly respond to it. So when, okay, there was a transition first from the decentralized appointment management to a centralized appointment management. So we came from a point where appointments were being specified in individual encounter forms. So for instance, in the green card, you'll find that we had the section for the appointment scheduling, where somebody put the date when the patient is supposed to come back to the clinic. So when we transitioned, we moved away from that to centralized appointment management that I've just taken you through, where all the appointment, regardless of the service, is being managed from the centralized module. So for some reason, I think that transition had some effect in terms of calculating the TX card. And I think we've gone through several iterations to ensure that we catch up with that. And I think within the last iteration, which is 19.1.1, I think we had very few facilities still lamenting about the variance in their TX card. But I think largely we were able to sort out some of those calculations for the appointment, and most of the facilities are now reporting accurate numbers on the appointment. But it was affected by that transition, and also moving forward, it will be very important to iterate to the users that it is important to really ensure that for every encounter you capture the appointment date. Right now, I think because there's no way for now to enforce and validate that field so that everyone has to fill it, because right now it's a button that you click and it opens up the appointment form. So there is no validation on a command button, but we something that the developers are working towards to ensure that that form will not save if you don't specify the appointment for that particular patient. So it's something that we are working on continuously. We are sure we'll be able to be there. But in terms of effect on TXCAR, I think it has been handled and it has been minimized to a very, very negligible level. Thanks, and over.
All right, thank you, Tiana. And I think that also answers the question by Jel Odwar. It's tied to what you responded. It's also tied to and thanks, Adeline. I think you already emphasized on the same, and it also responds to Hilary Kios. I think he's raised the same concern. So there's a question from Jessica. I want to probably allow Magdalene to take this up. There's a question from Jessica. I don't know where to pick this up from, because he's asked, and also the issuance of ARVs in the system, current regimen missing. Maybe Lillian, Magdalene, you can respond to that. Then when patients are requeued or requeued, are requeued, and are they placed back immediately in the list, or does it, how many minutes? I think what Kip wants to know is how much time does it take for the patients take, the clients take for them to appear in the queued list. So maybe Magdalene, you can respond to those two. Then I can then go to Taban, Vivian first, then Maureen, then Taban. Though I can see Maureen's hand is down, we will start with Vivian, then go to Taban. Magdalene, you can make a comment on that.
So I'll make on the first one, I see, are we able to filter bills for the specified? Yes, we are able to filter that in the payment options, that is on the admin level. Then we have the issuance of ARVs in the system. Yes, all the current regimens are in the system. And we are also able to have drugs available, where if you noticed, it was not like in the services, but they were in the commodities, where you are able to search the drug that you want to add as available, and then add the price. Anything I've missed, Songok?
Yes, I don't know that this will be responded by you or Tiano. When a client is requeued, do they appear immediately, or how much time does it take for the client's details or name to appear in the queue when they are requeued?
It will appear when you are now going to serve the next patient. So after you are done with the one you are doing, now the other one comes back.
So let's say it's real time, right?
It is real time, yeah.
Thank you. All right. Thank you very much. Right. So I think we can then transition to hearing from our other colleagues whose hands have been up. So I'll start with Vivian. So maybe Otieno, you can allow Vivian the mic to speak. And then after that, we will allow Maureen, then Taban. So we can take the three of the questions. So maybe Otieno and Magdalene, let's take that up, and then we respond to the three. So Vivian, go first.
Thank you for allowing me to ask these questions. And I want to appreciate the slides, and I want to appreciate the presenters for that job well done. I have one question on billing and one question of appointment. On billing, I saw we can bill via so many methods, that is M-Pesa and other forms. Is it claims? Is it other insurance? If a client has a bill of 100 shillings and she has M-Pesa 50 and she wants to pay the other one in cash or M-Pesa, does the system allow that kind? Because I had something like partial method of payment, that the system allow one client to pay via M-Pesa, via Visa, via insurance. And I think I didn't get it that clearly. On my, I think that will go to Magdalene. And the other question was on appointment, that is to Bernard. I saw it's a bit comprehensive. The module is a bit comprehensive compared to what we've been using. But on downloading the Excel output, I really wanted to know if there is a slot for contacts because I saw the numbers, some details, but the phone numbers didn't appear when you're trying to download. I just saw something like status, but I didn't see anything for phone number. And you know, phone number is one of the key important detail or biodata that helps in tracing patient who was missed for appointment for one reason. In the appointment, does we have any app or anything like for patient tracing? Maybe a client was supposed to come for rescreening, we didn't see the client, so we want to do a follow-up through phone call, and we get to interact with the client, and the client explained to us why she didn't come to appointment. And on accounting why we have so many missed, we would like to include that our patient tracing efforts have been felt and that there is that documentation or that part in detail. Thank you so much.
Thank you, Vivian. Now we can go to Maureen.
Thank you, Songok. So mine was on the variance on the TX. We've been experiencing this variance in the past 2 months, but Otieno has clarified the issue was because of the centralized appointment module. So for now, there are some clients in my facility who are still appearing as lost to follow-up, yet they have future appointments. Now that the centralized appointment module has been rolled out, how am I going to go about it to clear the missed appointments so that they come back to active plans? That's my question.
Thank you, Maureen. Taban Odhiambo. Taban, if you can hear me, you can go ahead. Otieno, confirm if you've allowed Taban to speak.
Yes, he just needs to unmute.
Taban, if you can hear me, unmute and go ahead.
Fine now.
Yes,
Yeah,
it is.
confirm.
Go ahead.
Oh, thank you so much. Thank you for the good presentations. Mine is also just a follow-up on the last comment. Are we going to resort to really manual way of updating the missed appointments? I would love to hear if there's a solution to that now that the repetitive nature of appointments and how it affected the TX has now been resolved. But still we have a challenge in manually updating the clients that were false missed appointments. On to my question, is it okay to really include a flag for how many clients have already been booked in the HIV green card? In the HIV green card, under the care panel or the hamburger menu, so that the clinician is able to note, just like before, that I've already booked. We have already booked maybe 40 patients this date, so that you can reschedule, so that you don't have a busy clinic. In as much as I appreciate that now appointment management has been centralized, and it's not in the various clinical encounter forms. The next question is on when you click the missed appointments so that you can download for maybe tracing attempts, you are getting the age, the names of the clients, and the CCC number is missing. I don't know, because of the other variables that are missing, just like someone has requested, I know telephone number and also the issue of data protection. Which variables can we really get bare minimum to help us in a very effective way of tracing those clients? Because it looks like for now we have to really go back to charts or research the client for us to get the other details that are missing, because the name is there but telephone number is missing, or if we replace name with unique ID, then somehow you still have to go back to the client to search for some biodata that is missing for you to start calling. Lastly, will there be a way we'll do inventory update in the system for pharmacy, or all the drugs, essential drugs and so on and so forth, or we'll just have to do it manually? in terms of updating when we'll use the pharmacy module for OPD. So yeah, that was my question. And also just to confirm, there are some drugs that are not available, including ART, TDF3, TC, DTG, not available even under MCH when you are handling a PMTCT mother. If a mother is already on ART, you are not able to find some drugs. Yeah, so I don't know if it's the 19.1.0 that has it, but I think it's missing in the previous year. Thanks.
All right, thank you. Thank you very much, Taban, Maureen, and Vivian. So I really don't want to run through the questions because of time, but I'm hoping that Magdalene and Otieno had taken note of that. So I will allow Otieno to go first, and then Magdalene can respond to the questions that probably Otieno will not have responded to. I think the participants had specified the facilitators who probably the questions were meant for. So Otieno, you can. Thanks.
Yeah, Sanguk, I'll try to go first. I hope I captured majority of the questions. So the first question I think that came from Maureen was about the variances in TX card, and she's saying that there are some patients that have future encounter but are still marked as missed appointment. Yeah, so I think I wish I knew the version of EMR that she's using, but I think these are isolated cases that can be checked. So I'll just maybe ask Maureen to liaise with the service desk so that one, we check which version you're using. If it is a lower version, then we'd recommend that you upgrade. But if that issue persists, then we'll need to check it through our service desk to establish the cause and see how we can be able to correct it. So the number for the toll-free number has been posted on the chat, and maybe I'll ask Kubutu to post it again so that you can reach out separately for that to be resolved. Then there was the issue of downloading the Excel for the appointment, where you said that you are not able to see the numbers. Yeah, I think the last person who commented said talked pretty much about the information protection. So I think that is what informed dropping of that particular column. I do not know what the latest is in terms of availing alternative avenues to identify these particular plans, but I think I can check, or maybe if Magdalene, you have latest information on that, maybe you'll be able to share if there is any alternative approach on how we can identify these patients without really identifying them through their mobile number or something like that. The other one was drugs that are not available, especially in the MCH module. So again, this one also needs to be checked which version it is. If at all it is truly missing, then I think we need to have it as part of the feedback so that we are able to include the missing drug and have it maybe as a patch or something like that. The last one I think was the inventory for essential drugs. Should we do it manually? Is there an automated way? So for the essential drugs, ideally, the system comes preloaded with all the essential drugs. I think Magdalene was able to touch on that briefly. So the only thing that happens before you start using your commodity module is that you need to first of all do a stock take and establish the opening stock for all the pharmaceutical products that you have in your store, in your main pharmacy, so that as now the transactions are being undertaken on those particular stock items, the system is able to correctly deduct from the stock that you had already specified. So it will be very important that you start by doing a stock take and then establishing the opening stock for all the items that you have. Then from there, the system will now be able to deduct accordingly and also warn you when you are almost going at zero for any particular item. So I don't know if there's anything I missed. Maybe Margaret, you can chime in.
Yeah, I think you've responded to most of them. There are only two that are remaining. Maybe Magdalene can respond to that. The first one was whether the system allows one to, when you're doing billing. And I think Magdalene had demonstrated that. The answer to that is yes, but I think probably maybe you can emphasize on it. Because the question from Vivian was, are you able to probably, if a client is meant to pay 1,000 shillings, and the client has maybe 500 in M-Pesa, can you then divide the amount, the 1,000, to the various modes of payments? The answer, I think she had demonstrated that, but you could probably just re-emphasize on the same. And then the other one was whether it's necessary. I think this was from Taban Odhiambo, to include a flag in the green card. So maybe those two are those that are pending. I think the rest you responded to. And probably maybe Magdalene, if there's any other comment that you would want to make in relation to the questions, you can go ahead. Over to you, Magdalene.
I think you've responded to the one on the payment methods. Yes, you are able to do one payment method in two different, like one payment in like different methods. That is possible. Then for the green card enhancement to have a flag, kindly, Taban, you can just do that in the form, and then you are able to take that up as a enhancement. And also on the drugs and the inventory, I think we did a patch on what we had in 19.10, and we have tried and included the drugs that were reported missing. But kindly, if you find any other drug that is missing, kindly just make sure that you send them to us so that we are also able to add the same. Thank you.
All right, thank you very much, Magdalene and Otieno, for the good work, and of course the whole team for the good work that has gone into this. So we have 3 minutes to the top of the hour. We intend to end this at exactly 4. We don't want to keep you any longer. So at this point, we can then we can end our session, and I want to just request a few of our colleagues who are in the call to make some few remarks. But before then, I still want to appeal to all of us to fill in the feedback form. I don't know whether, Otieno, you're able to monitor and check on the numbers who've been able to fill from your end. If you can, the better. If you can't, it's still okay. We would really wish that all of us complete the feedback form. So let me take this opportunity to.
Sorry. We only have 32 out of we only have 32 so far that have completed.
Yeah, 32 out of 300 plus. All right. Please, it's a very humble request. Let's complete the online form. I can repost it again. And we'll not end this call after we've closed. If you want to take a bit of time, the beauty is that it's available on chat, so you can also just complete it at separately. But we would really wish that you complete as we as we are in this training. Kindly, please just help us, give us some quick feedback. So I was saying that I want to take this opportunity to appreciate all of us for attending this training. This is very important. Remember, the reason why we're doing this is to build your capacity to be able to utilize these modules or the features, and of course build our case in terms of scaling up, not just utilizing, but just scaling up KenyaEMR3 in our facilities. I think all of us appreciate, and we've seen the features that is coming in with what it's able to do in terms of managing our clients. It's really very helpful in terms of seamlessly following up our clients and of course managing them up, tracking from one point to the other. So we really urge you to take this up and support us in rolling it out. So I don't know whether Diana is still in the call. I think I'd seen her. But just confirm if Diana Toy is still in the call. Seems to have dropped. All right. I think Diana seems to have dropped. So at this point, I want to just maybe request Otieno to make 1 or 2 comments as we close. Otieno.
Yeah, thank you, Sunguk. I think I just want to take this opportunity to appreciate everyone that has been with us in this series of trainings from when? From 12th of August to date. I think that has been really, really very great interacting with you almost every week, taking you through different modules in KenyaEMR3.x. So I think that has been a very interesting journey. I believe that we have been able to impact some skills, and you've been able to improve on your proficiency in navigating and utilizing KenyaEMR. So today marks the end of the first series, the first round of these trainings. We are going to go back, look at your feedback, and see the areas that we can now consider for the next series. So we are hoping that come next month, we may take a rest maybe in between for like 2-3 weeks, but we'll resume with another round of trainings, depending on what we have on your feedback. I'm able to see which other suggested topics that you'd like us to take you through. So that is our responsibility. We'll be able to come up with a schedule, which we'll share with you, and again call you to this training so that we can have continuous sort of training and also build your capacity to utilize the system. So having said so, I'd just like to reiterate and take this opportunity to thank everyone that has been with us. Look forward to engaging with you again in the coming training. Otherwise, thank you, and back to Songo.
Thank you very much. Thank you very much, Otieno, and thank you very much, everyone. Feel appreciated. So I think for the guys who have the mic, we can unmute and say the grace as we close. Adeline, Magdalene, Ogutu, and Otieno, you can unmute, and all of us say the grace. I'm waiting for everyone to unmute. Otieno, you haven't unmuted. Adeline, Otieno. Yes, so we can say the grace. So we can say the grace as we close. So may the grace of our Lord Jesus Christ,
Lord Jesus Christ,
and the love of
and the
God,
love
the
of
Father,
God, and the
and
fellowship of the
fellowship
Holy
of the Holy
Spirit,
Spirit be with us
be
now
with
and
us now
forevermore.
and
and
forevermore.
forevermore.
Amen.
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 Thank you very much, and bye, everyone.
Good day.
See you next time.